The deep phenotyping of post-infectious MECFS study released online this month in Nature Communications seems
Yep.
to imply that prolonged infection from, say, a bacteria or virus alters our immune system and gut microbiome.
Yes.
In ME/CFS sufferers, they kind of said this leads to a chemical alteration in the brain and nervous system, so that part of the brain that controls motor actions fails to function adequately, leading to fatigue and post-exertional malaise. Do you agree with their findings?
Yeah, that's basically the main theories right now is that some sort of overwhelming stressor like an infection causes brain-based changes. And they're usually identified at the level of the glial cells. And the glial cells, what happens is that they become activated. And so when I talk to patients, I say the glee is gone out of the glial cells and they're unhappy.
Mm.
And so that they produce inflammatory cytokines. What happens is patients are stuck in a pattern where that cycle of activation can't be turned off. Because normally what would happen is with a stressor, you'd have an activation, you'd have resolution of the stressor, and then you'd have the body go back to baseline. What happens with ME/CFS, long COVID, fibromyalgia, is a switch gets stuck in the on position. And so that you can't turn off this cycle of glial activation, which leads to activation of the fight or flight system and dysautonomia, immune changes, inflammatory changes, and a whole bunch of changes downhill from the brain-based changes. Our best understanding right now is that it's a neuroinflammatory condition.